Hello, in the next 10 or so slides, I'm going to give you a practical overview on how to complete the case presentation assignment on your surgery clerkship. The steps are as follows. First, find a general topic and a patient that corresponds to it. Second, you need to do some background reading, and from this background reading, create a 5 to 10 minute PowerPoint slide presentation for peer teaching. Third, frame the question, meaning find what you want to investigate. Third, write the history and physical write-up. And then you need to do the literature search next, followed by evaluation and interpretation of the literature. Lastly, you need to create the presentation. Finding a topic. You'll be assigned one of the core topics for presentation and identify an appropriate patient with the corresponding surgical disease process. This approach will help us learn about these important topics together as a group. The patient can be found through either the clinic, the pre-op history and physical clinic, inpatient consults, or assigned OR cases. And the core topics we'd like to try to cover are hernias, thyroid, parathyroid diseases, melanoma, morbid obesity, pancreatitis, colon cancer, hepatomas, aortic aneurysm, carotid stenosis, and lung cancer. Once you have found a topic and the appropriate patient, you'll need to first do some background reading before you start thinking about a question. I recommend you find a good surgical textbook or a good review article. As part of the group study plan, I expect you'll create a 5 to 10 minute summary on a PowerPoint presentation that we will share together with your peers. And then during this process, we expect that you'll start to see the potential interesting questions arise. It is important to recognize what to avoid when you're trying to find a good question. We do not want a broad overview. We want you to focus on one specific question. We also don't want a very controversial topic that is just beginning to be understood. A better way to think about this exercise is that you're trying to understand and evaluate the evidence for our current standards of practice. So why do we do what we currently do, and how strong is the evidence for it? In fact, a really good source of questions are practice guidelines that are regularly published in specialty journals. Some broad topics of interest are things like accuracy and utility of diagnostic studies and algorithms, evidence examining surgical versus medical treatment, and of course comparisons between different surgical options. One of my personal favorites are looking at quality of life measures that take a longer view on the outcomes of patients in a more humanistic way. Before you start on your literature search, though, I recommend that you finish most of your history and physical write-up and also turn your PowerPoint background slideshow into a Word document. This way, half of your assignment will be done before you start. Remember that we expect a well-organized history and physical that appropriately synthesizes and interprets the data. The key activity will be to correctly decide which information belongs in the main body of a history of physical and which should remain in the quote-unquote appendix section. Also, you should highlight any discrepancy in your patient's presentation when compared to the classic textbook presentation and be able to explain why this discrepancy still doesn't change your diagnosis or your thoughts about the case. And lastly, in your assessment and plan, make sure you clearly explain the indication, what options are available for treatment, and the risks and benefit of each, and why you chose the option that you did. And here I would recommend that you include a short summary of the literature search or the findings of the literature search. It's not going to steal your thunder to do this. Starting the literature search. The method that I recommend, I call it the Janus approach, named after the Roman god of beginnings and endings, and the one who looks forwards and backwards at the same time. So basically, the strategy is you pick a good paper, a landmark or a famous paper, and you can tell because it's in a good journal and it is typically cited in a chapter or a review as an obviously major paper. And from this paper you will look backwards and forwards. You look backwards by looking at the references, and it's assuming that a good paper like this will include in the references pretty much all the relevant articles or all the relevant articles. And you look forwards with an assumption that any good publication or study on this topic will have cited this landmark article. And way to do that, the most common way I use is the Web of Science through the UCSF library. You can also use PubMed and Google as well. But in the end, the goal is that you don't avoid missing any of the articles, but you avoid missing the big major articles. Okay, so you can feel confident in your presentation that you have not missed anything major. The next step is you need to sort through stuff because you're going to have a lot of articles, and you can quickly do this, and you're going to have to quickly do this, and you can get rid of them, a lot of them by just looking at a title. A lot of them are going to be unrelated. And the other part is the impact factor of the journal. You will have to get familiar with which journals are important. Obviously, journals like New England Journal of Medicine, JAMA are big important papers are going to be presented in them. Then you're going to have to get familiar with the next tier, which is usually Annals of Surgery or Archives of Surgery for general surgery issues. And then there's going to be one tier lower, which are going to be more subspecialty based. But the other thing that you can be pretty comfortable with is if they're obscure journals from faraway places that don't have major impact, you can pretty much ignore those just based on the title and the journal they're published in. Next, you'll have a set of the abstracts, and you're going to have to read a bunch of abstracts and exclude those publications based on the abstract. Either the topic is unrelated, even though the title seemed like it was related, or they're of really poor design and small size relative to what you find. So if most of the papers include patients in the hundreds, and you find a few that have patients, the N is only in the 10s or 20s, then you can most likely exclude those articles because they're not going to be that significant in the end. And so finally, when you're done with the sorting, you should have about 10 articles that you can dig into, okay? So evaluating and interpreting the literature. You don't have to read all 10 papers. You should read all the abstracts carefully, and you should figure out which ones are the best studies. And then you need to decide whether there's discordance or concordance in the results of these papers. If they're concordant, then it's relatively simple in that you try to pick the one or two best papers and then use them in your presentation as being representative of the best pieces of data. If they're discordant, then you should choose the best representative from each perspective and then use them in your presentation. And it's going to be a little more work because you're going to have to try to explain why they're different. And it may be a good learning point for you to try to figure out why that's the case. A lot of students like to rely on meta-analysis and systemic reviews. I think they're best as secondary supportive evidence rather than the primary driver of your argument. And part of this is because they lend to a more superficial treatment of the topic. It doesn't really get you into the depth of pathophysiology, mechanism, logistical confounding factors, or patient factors, which you can begin to understand when you actually read the primary data and the studies themselves. Finally, you want to create the presentation. And the key word here is be explicit. Try to be explicit about your rationale, your logic, why you're presenting what you're presenting. So with the question, why is the question you're asking important? And then you need to start explaining what our current understanding of this problem is. Why do we think this problem occurs and how it occurs? And then what the hypothesis in terms of what additional information or what additional knowledge do we hope to gain about this disease process. So for example, if you're trying to compare one procedure being better than the other, you should explain the pros and cons of each. And better yet, you should explain what we would expect to see in the empirical evidence if one option was better than the other. What's the endpoint that we would be able to look at? And by prefacing it that way, then you can go into the primary data, describe the design of the study, and then interpret the findings referring back to the endpoints that you are looking for and that you would expect. And once you present the endpoints, then you can then go then explain whether they actually confirm or dispute your original hypothesis. And of course, you should always end with what the limitations are for the study, what the design flaws are. This helps with the internal validity. And meta-analysis can, again, provide additional support. And then lastly, it is best that you apply the findings to your own patient and explain how it guides or how it guided or did not guide your management of the specific patient. And this is referred to as external validity. And I think once you've done this, you'll have a better understanding of the disease process. You'll get good practice in doing efficient literature search as well. Thank you.